Hello, my name is Chris Foster, and I'm going to be presenting this webinar today, what Developmental Pathway, a Vision and Framework to Inspire and Inform Our Efforts. We have several objectives for today that include your ability to describe the developmental pathway and its purpose, explain how it is structured, compare the similarities and differences between the developmental pathway and the local problem framework, understand the relationship between the local problem framework and the targeted problem framework, as well as to summarize how the developmental pathway is used to determine the targeted problem in the child and family outcome assessment process. Our webinar today will be in 3 sections. Each will focus on one of these questions. First, what is the developmental pathway and what is its purpose? Next, how does the developmental pathway inform the child and family outcome assessment process? And finally, what happens once we have a targeted problem? So let's get started with the developmental pathway, what it is, and what its purpose is. I'd like to start with our mission. As you know, the AOK Network's mission is focused on promoting healthy pregnancies and the positive growth and development of all children birth to 5 and their parents and caregivers. And we do this by assuring a well-coordinated, easily accessible, equitable, and just system of services and supports that engages parents as partners in making the system work for them. When we talk about promoting healthy pregnancies and the positive growth and development of all children birth to 5 and their parents and caregivers, this is also reflected in our conceptual framework in the lower right-hand corner, where we list the 3 main child impacts that we're interested in. And that includes babies are born healthy, young children are safe, healthy, and developing positively, and children are kindergarten ready. The question becomes, how do children achieve these impacts? As I'm sure you know, to achieve these impacts, children and their families must achieve a continuum of outcomes over time and across multiple domains. The graphic below is overly simplified, but I hope it reveals this big idea. You'll note that the orange boxes show each of our 3 key impact areas. Babies are born healthy, young children are healthy, safe, and developing positively, and children are kindergarten ready. These go across a continuum from pregnancy through entry into kindergarten. And along this continuum, there are a number of outcomes grouped in similar domains across all 3 impact areas. And these reflect some of those outcomes or the areas of outcomes that we hope that all children will achieve. And we also focus on outcomes for families because we know that outcomes that families achieve has a huge influence on whether their children also achieve the outcomes for themselves. So domains such as parents as children's first teachers, parents provide safe, healthy environments, parents engage in family supports, and families are self-sufficient and healthy. And we'll look more at these in a moment. So let's zero in a little bit closer so we can actually look at some of the outcomes. Babies are born healthy. For that impact area, the outcomes in the upper right-hand corner are the ways in which we will measure to what extent babies in any community are being born healthy. So more babies are born at healthy birth weight, more babies are born full term, and there are fewer infant deaths. We know, though, that in order for those outcomes to be achieved, we have to look closer at the early success outcomes. These are outcomes that usually precede but contribute to reaching these other outcomes. So across these 3 areas of health, safety, and positive development, you'll see a number of different outcomes associated with each domain. And we do the same thing for the other 2 impact areas as well. And while this is not the focus of this webinar, I do want to also note that when we talk about how children achieve their outcomes, of course, a lot of it has to do with them and their parents, but they also need us. They need us to be working together to coordinate our efforts because in our communities, different agencies, different sectors tend to focus on different sets of outcomes. And so together, and only together, can we fully address the whole spectrum of needs that children and families may have. So the better we can work together to meet those needs, the better off children and families will be. Here's a closer look at the developmental pathway itself. This tool has 3 different pages with 3 different sections. The first page focuses on the child impact outcomes. Again, these are the outcomes that we use to measure whether children are actually achieving those impacts areas. On page 2, you'll see that it's still organized by the 3 impact areas, but this contains outcomes that we refer to as early success outcomes, which are just those outcomes for children that usually precede reaching the child impact outcomes. And then in order for children to reach their early success outcomes, we all know how important that it is that families are reaching certain outcomes, because that definitely will have an influence. And so page 3 outlines some of those outcomes according to the 4 domains that we saw in the earlier graphic. Here's a different kind of snapshot of just the domains that are found across 3 pages in the developmental pathway. You'll see that there's quite a few similarities across the domains, for the domains across the 3 impact areas. And we did this to make it easier when we start collecting data and kind of looking to see how are children doing relative to health, for example. So you'll see that for babies born healthy and young children are safe, healthy, and developing positively, we focus for the most part on domains related to health, safety, and positive development. And then when we start talking about children being ready for kindergarten, we're still focused on health, physical development, and then instead of positive development, those kinds of outcomes are grouped under kindergarten readiness. And then finally, the parent, caregiver, or family early successes are on page 3, and those are listed there. So I want to take a few minutes to talk about how to read the developmental pathway, because the developmental pathway is really powerful because of the outcomes that are included in it, but the structure and the way that's been designed also is an important piece for understanding the connectivity of the outcomes. And so as we look at the developmental pathway from left to right, as you already noticed, I'm sure, the child impacts start prenatally. So what happens with expecting moms before birth, all the way through what's happening with then those newborns, infants, toddlers, preschoolers, and then eventually kindergartners. And so this provides a chronological look at the outcomes from conception through entry into kindergarten. And here's a close-up of the child impact areas. Again, this first section includes the outcomes for how we're going to measure whether babies are born healthy, whether young children are safe, healthy, and developing positively, and whether children are kindergarten ready. Now let's talk about how we read this pathway vertically. This is just a simplified graphic that represents the different pages and how those pages are ordered in your developmental pathway. The first page with the child impacts, second page with the child early success outcomes, and then the third page with the family early success outcomes. This vertical structure provides a framework for thinking about the family and child outcomes that usually precede and contribute to successfully reaching the child impacts. So I know that this is nothing new to all of you, but I want to just make sure that it was explicitly clear that this developmental pathway is designed to represent what we know about how family outcomes influence child outcomes, and then how some child outcomes influence other child outcomes. So this is something that is just important to recognize as we work with the developmental pathway. So here is a snapshot close-up of the child early success outcomes. Again, you can see the different domains that we've talked about, as well as the very specific outcomes for each of those domains. And as we've said, we continue to organize these across those impact areas. So it's possible to not only read our developmental pathway kind of across the chronological development or over time, but also for any one impact area, we can look at the impact outcomes, the child early success outcomes, and then the family early success outcomes. And here are the family early success outcomes. We use family for shorthand in the developmental pathway, but we also mean, parents as individuals as well as caregivers who may be not biological parents. All those who are taking care of young people are included here. You'll also notice that here this is not divided up by impact area, and that's because we believe that all of these family early success outcomes have an important role to play in helping to achieve all three impact areas. So there's no differentiation here. So let's take a few minutes now to talk about the purpose of the pathway. There's actually three purposes, and the one I'd like to start with is this one around providing a comprehensive vision for early childhood success. So what the pathway does on one hand is it illustrates how important child and family outcomes over time work together towards our desired population level child impacts. And when I say population level, I mean we want these impacts for all children. And so what this developmental pathway is kind of a big picture, if you will, of many of the most important outcomes that we want children and families to achieve so that they can be healthy, well, safe, and really developing on a positive trajectory. What this comprehensive vision also does then is it enables our partners from across the various sectors to see how their efforts fit within a more comprehensive vision for children and families. As we all know, individual agencies and organizations and even sectors tend to focus on a very specific range or set of outcomes that they're most interested in. And so the graphic here on the right helps kind of illustrate this. I've pulled some of the outcomes from our developmental pathway, and certain ones just seem to align more with certain sectors that are involved in our AOK efforts. So for example, more children are at a healthy weight. Those that are interested in the health of our young children and families are going to be probably more interested in that outcome than perhaps the faith-based community or others. That's not to say that this is always exclusive, but the big point here is to realize that in order for all children in our community and their families to be healthy and well and developing positively, no single agency or sector has the capacity to meet all the possible needs a family has for supports and services to meet those outcomes. And so it's important that as an AOK network that we have a vision, both in terms of our vision and mission of what it is that we're doing, but then the developmental pathway also provides us with an additional framework for really seeing how this diverse array of outcomes across various domains all reflect what we want for children and families. And so while all our partners may not be interested in all the outcomes in our developmental pathway, hopefully they'll be able to see that there are outcomes in there that are important to them, and that this developmental pathway can help us all see the critical need for all of us to be working together to meet child and families' needs, and not just to work in our individual silos. We can better serve families working together. Another purpose of the pathway is that it informs our child and family assessment process and our overall planning efforts for our child and family initiative. So first of all, it informs our data collection for the child and family assessment because we use this developmental pathway to inform what data we collect in our community about the children and families in our communities. We also use the developmental pathway. The structure of it helps us be able to analyze and make sense of data because of the way it's organized around specific domains and across these impact areas. The data we collect in our tools, it already organizes it. So for example, we can look at all the health data for babies being born healthy and not only be able to identify specific outcomes that maybe not be being reached, but also we can then look at all the data related to health for healthy babies and just kind of get a bigger assessment of how we're doing from a health perspective. And this can be done for any of the domains. And you'll learn more about this in the on-demand webinar that goes through the full assessment planning and action process for the Child and Family Initiative. As we've already talked about, the framework also helps us see how different outcomes relate to one another, both chronologically over time, as well as around the different domains. And so while this is something I'm quite sure we're all aware of, I hope that the developmental framework or the developmental pathway reminds us that we can't be looking at outcomes in isolation and realizing that even if we're focused on health, for example, if there's issues of safety or development that are also contributing to those health issues, we really need to be working together to make sure that we address all of those issues in a way that kids are healthier, safer, and developing positively. This will make more sense in a little bit, but the way this framework is designed and the way that we use it to inform the child and family assessment process also makes it easier to identify what we're referring to as the targeted problem at the end of that process. So while we start out very broad and assess all these different outcomes, in the end, what you're going to be doing is summarizing just the problems that you identified through the assessment and analysis process. And then from there, you're going to further identify a more specific set of child and family outcomes that you'll focus on for your child and family initiative. So again, you'll learn more about this in the Assessment Planning and Action webinar. But for now, just know that these are some of the reasons that this developmental pathway is going to help us with that assessment and planning process. And the last bullet here is that it won't only be limited to helping us with the child and family assessment process. It will also help us with the next phase, which is where we focus on how we can improve the service delivery system so that we can better support the children and families who are experiencing the problems in our targeted problem framework. So you'll learn more about this as we go, but I just wanted to note those issues related to the assessment and planning process. Before I move on, I'll just also note that there's two versions of the developmental pathway. This version I'm showing here is the color-coded version. It kind of color codes, if you will, the type of data sources that are related to each outcome. So for example, as we look at health that's in green, that represents county level data sources that might be available to you to find data. And so we're not going to go into those details right now, but know that it is color coded to set that up to make that easier. What I will tell you right now about the child and family assessment process is that the tools that you're going to get when you do that part of the process, that's where you're going to find the specific indicators and data sources for the outcomes that you find in the developmental pathway. So these are shots of the 2017 tools. These will be adapted for the next time we use them because of some recent updates we've made to the developmental pathway. But I do want to also just note then that there may not be data available on all the outcomes that we have in the developmental pathway. Most of them will, but there are a few outcomes that we've included because we know they're important, even though there may not be data that's easily available. So just know that, and also know that we will continue to update this pathway as the science evolves and we better understand the outcomes that are critical for development and health and well-being, as well as access to data as that evolves and makes more available. So just wanted to share those quick few points about that. So the developmental pathway actually, again, sets the whole framework for our child and family outcome assessment and all the tools that will come in that phase. All right, the third purpose of the pathway is that it allows us to tell a statewide AOK network story while also honoring the local individuality and local stories of each of your networks. And so, as you're all probably familiar, it can be really challenging to tell a statewide story when you have many different networks, all who are doing their own assessment, their own planning, and coming up with solutions that work for their communities. But with the developmental pathway and the way we organize our child and family initiatives, it actually allows us to both tell the big story and the individual story at the same time. So for example, this blue chart here shows which communities, which AOK networks focused on what during this current 5-year cycle. And so, for example, Stevenson and Tazewell both focused on healthy babies because when they did their child and family assessment process, their data revealed that not all babies are being born healthy or are at risk of not being born healthy. And so in that place, the story is similar, but when we look more closely at some of the other very specific outcomes that weren't being achieved, so in fact our problems in their community, we see that there's some differences. So for example, with Tazewell, future babies there are at risk of not being born healthy because some women pregnant are smoking during pregnancy. But in Stevenson, the issue is more around drugs and alcohol during pregnancy. So they will each need to design their own solutions to the problem. And what this will allow us to do is tell the story about what AOKs are doing around healthy babies, but then also tell the very specific stories of what that looks like in Tazewell and what that looks like in Stevenson. And this really gets at the heart of what we know is referred to as community systems development, which is the work we're doing, though we don't usually call it that. It allows us to kind of tell the story that we don't use a cookie cutter approach. We don't have one size fits all for all of our networks. We share a process and frameworks, but then based on what we learn are the problems in each of our communities, then we design solutions that are going to work in our communities for the problems we uncovered. And so this ability to tell both the big story and the individual stories, I think, is a really important piece. All right, so let's move on and talk a little bit about how the developmental pathway informs the child and family initiative. So here is a picture of the assessment planning and action process I've been referring to. And this is what we use for the child and family initiative. Phase 1 is where we assess the child and family outcomes, again using the developmental pathway. And then phase 2, we assess the system to see what system issues are getting in the way of us best supporting those families experiencing those problems. Phase 3, we design strategies that is going to specifically work to address the system issues we uncovered in each community. And then phase 4 is when we implement, track, and engage in continuous learning and adaptive action so that we can continually striving to reach the outcomes that we're after. So I want to spend a few minutes just talking about the outcome assessment process. And this is just kind of a high-level snapshot of some of the key pieces I want to talk about today as it relates to the developmental pathway. So as I've said over and over again, as you know, the developmental pathway is outcomes, right? It's the outcomes we want for children and families. We use this then to inform our data collection and analysis for our child and family assessment process. All the tools that we use are keyed around that developmental pathway that helps us make it easier to analyze the data. And what we'll do at the end of that process, so we've analyzed all the data, we've identified where the problems are. What we're going to then do is we're going to create what's called the local problem framework. And you might notice that this looks a lot like the developmental pathway, and that's exactly right because it's built exactly the same way, though the focus is different. So while the developmental pathway focuses on outcomes, what we want for all children and families, excuse me, the local problem framework actually is just a snapshot of the problems that we uncovered through our child and family outcome assessment process. So it's only the problems. And from that local problem framework, that's what we'll use to sit down with our partners and other community stakeholders to determine which of these problems will become part of our targeted problem framework. And the difference here is that the local problem framework has all the problems we uncovered, and the targeted problem framework is going to be this more narrow, specific set of related child and family problems that you're going to focus on in your child and family initiative. So in this case, it's focused on not all babies are born healthy, with a number of problems that were uncovered. And you might notice here that these are all written as problem statements where we've just simply turned around the outcome into a problem. And you'll understand more why we do that when you view the assessment planning action process for the Child and Family Initiative webinar. So again, the local problem framework is really just a snapshot, if you will, of the child and family problems uncovered during the child and family outcome assessment process. You're going to use this to identify your targeted problem framework, and I'll say more about that in a second. But I think this is also a great document to have on hand throughout the 5-year cycle, because there may be points in time where you're going to want to come back and kind of look back at this. Maybe you're coming back to look at for other problems that you're now ready to start to address. Maybe you're coming back to just remember what some of the other issues were that children and families were facing, because it will inform what you're planning to do currently. It's a whole lot easier to reference this document, which is kind of a summary document, than it is to go back through all the other documents that you've been doing your analysis in. This would be a document that I would definitely key on your computer or in a binder, but have it handy because you may want to come back to this often. So again, the LPF design is exactly the same as the developmental pathway, both in terms of organizing across the child impact areas horizontally, but then vertically, showing the child impacts, the child early success outcomes, and the family early success outcomes. To take a closer look at it, it has 2 sections. So in the developmental pathway, you had the 3 sections, right? And they were around the child impacts, the child early successes, and the family early successes. Well, now all of those 3 are highlighted in the first section of your local problem framework. You'll see that in the 2 documents here on the left. So the one all the way to the left are your child impact problem statements. And then the document in the middle, the second page, shows the early child success problems and the family early success problems there. Now, the second section of the local problem framework provides the more detailed data summary related to these problems that you've identified in pages 1 and 2. So you can see here, for example, under child impacts, not all babies are born healthy is the impact problem statement. And then it says not all babies are born at a healthy birth weight. That was the outcome that we assessed and found it to be a problem. So we turned it around into a problem statement. And then underneath that, you'll see the two bullets that are the indicator problem statements that give the actual data that we looked at to come to the conclusion that not all babies are born at a healthy birth weight. And then the rest of this document does the same thing for each of the other domains and then the outcomes that we found were not being achieved, and it gives that very specific data. So you can see that this document could be a very handy resource to keep handy so that if there are ever questions about the actual data or wanting to go back and remember what some of the other problems that families and children were facing, you have this easily summarized to be able to look back. And this also makes it a more convenient document to share with others rather than all the other documents that have many, many, many more pages than you'd ever want to share with anyone. So the targeted problem framework then, as we said earlier, is the more specific set of related child and family problems the network has identified as the focus of their child and family initiative. So here again, you're seeing the first 2 pages of the local problem framework. The third page, obviously, and other pages would have all the detail. But then you would, from here, you and your network partners and others would decide which impact area are you interested in focusing on, and then what are the specific problems, the outcomes that aren't being achieved that will be the focus of your initiative. So here on the right is that summary. So we go from all of these other problems across the 3 impact areas, across the different domains for each of the different outcomes that were a problem, to a much more narrow set of problems as it relates to the outcomes in the developmental pathway. And we have it at the level of the impact, the child early success problems, and then the family early success problems. Just for language, just to be super clear, you'll see that here on this slide, all of what's here is considered the targeted problem framework. So think framework, it's bigger, right? It's got all the detail of the problems that you've uncovered as it relates to not all babies being born healthy. For shorthand, we will sometimes refer to what is your targeted problem, and we just say not all babies are born healthy, but when we say that, we're really referring to the targeted problem framework, which includes all the outcomes, or excuse me, the problems that we've identified and are showing here. This language will become more familiar when you're in the process, but for now, I hope that these distinctions are clear. All right, so what happens once we have a targeted problem? I just want to say a little bit about what happens in the next phase, phase 2, so you can understand how phase 1 and phase 2 connect. So once we have our targeted problem, we know which child and family outcomes are not being achieved, that we really want to work to do better to help support those families and children. In phase 2, we're going to understand how the system is supporting children and families, but also what are the ways that the system isn't functioning or behaving in the ways that are most helpful to children and families experiencing those problems. And so we're going to prioritize those issues before we move into strategy design. So let me say this another way. Basically what we're doing in phase 2 of the broader process is that now that we know what child and family problems are exist. Now we want to explore the system issues that are getting in the way of supporting families overcome those problems. So what we're going to do is we're going to look for root causes. And what I mean by that is so often we can identify some system issues that get in the way, but we are quick to jump to action because we care. We want to help families, and that's a great thing. But unfortunately, what happens is when we jump too quickly to action and try to solve a problem, before we really understand what's causing the problem, we then sometimes find ourselves back in the place of the problem coming back. And so with systems change work, we are interested in making sure that we're permanently changing the system. And so what we do in the system assessment process is we explore those system issues and get to the root causes. And we're looking for issues like access, what's getting in the way of families accessing services, what are some of the coordination issues that are getting in the way? For example, families may be engaged in part of the system, but really need to be also engaged in another part of the system to get other needs met. How are we working together to make sure we're referring those families, for example? Equity, are we making sure that the families that are most experiencing the problems in the targeted problem framework are actually getting the services and support they need? And then parent voice, in what ways are we actually engaging parents in understanding these system problems and helping to figure out the answers to those problems so that they can best be served? And so all of these issues are really important to be clear of, and that's again where we need to work together because often it's these bigger issues of access and coordination and equity that we can't solve alone. We also dig deeper to make sure that the issues that we're uncovering for any of these four areas, that we know what kinds of issues we're working with. And so we rely on the Able Change Cloverleaf to help us with this. And these are what they refer to as system characteristics. So they're more specific types of system issues. So for example, when we're looking at access issues, we could have access issues that are due to mindsets or components which have to do with how the services are offered or where they're offered, or the quality. It can have to do with the connections between different parts of the system or the regulations, which can be policies and practices, just how we get things done. Kind of resources, whether that's human knowledge and skills or other kind of financial or community resources, how those are used or maybe the lack thereof. And also how decisions are made. And then of course the interaction between all these characteristics is also important to understand. So by getting to root causes around access, coordination, equity, and parent voice, and by also understanding the type of issue it is, can help us determine which root causes to address that can best help us as a system better meet the needs of children and families and overcoming the problems that they're experiencing. So there'll be a lot more of this in the future. But for now, just want you to realize that what we do in the system assessment process is completely and intricately tied to the family problems in your targeted problem framework. And so just to give this a little bit more of an example to maybe help make it a little more clear. So this is overly simplified, but I think it'll give the idea that if we have fewer babies that are born at a healthy birth weight, we ask ourselves why this is happening. Well, one of the reasons is that more mothers are using substances during pregnancy. And then we have to start asking us, okay, so why is this happening? What is it within the system that we're doing, or it's getting in the way of preventing those mothers from getting support around the use of substances during pregnancy? In this little brief example from Stevenson County, they determined that there were no county-based inpatient substance abuse services for pregnant moms using drugs or alcohol. And so we didn't stop there. We had to keep digging for root causes. So we asked ourselves, why is this happening again? And one of the things we learned was there's not enough trend data to indicate the need for local services. Well, is that the bottom root cause? We had to keep asking, well, why is that happening? And the answer that came was that there's not a dedicated system or data set to specifically track drug-exposed babies. Well, it still wants us to ask why one more time, and they discovered that it's because this is really an emerging issue and there's never been a need to track this data. So now with this level of detail, they can get really clear on exactly what needs to happen to shift those system issues so that services can be available to mothers who are using substances during pregnancy, and hopefully then fewer babies will be born at an unhealthy birth weight, and we will be better prepared to meet those needs of those families and those babies. So I hope that this webinar has met our objectives. In summary, I hope that it's now clear that the developmental pathway is a set of outcomes that we use for all, that we desire for all children and families, that it serves both as a vision of what we want, that it informs the child and family assessment process, and that it helps us tell a statewide story of our efforts, that the local problem framework is a comprehensive snapshot of the child and family problems uncovered during the child and family assessment process. Looks a lot like the developmental pathway, but now it's framed in terms of the problems that we uncovered. That AOK networks select a set of child and family problems from their local problem framework, and that this becomes their targeted problem framework. And during the system assessment, AOK networks explore the system issues that get in the way of families overcoming the problems related to their targeted problem. So thank you for your time, and I hope you found this to be beneficial.